Pharmacology, the cardiovascular system. Fibrinolysis. The stabilized clot is acted on by contractile proteins within the platelets. As these proteins contract, they pull on the fibrin threads, bringing the edges of the clot more tightly together, as we do when tightening loose shoelaces. This process also wrings out of the clot a small amount of fluid called serum, which is blood plasma without its clotting factors. To restore normal blood flow as the vessel heals, the clot must eventually be removed. Fibrinolysis is the gradual degradation of the clot. Again, there is a fairly complicated series of reactions that involves factor 12 and protein catabolizing enzymes. During this process, the inactive protein plasminogen is converted into the active plasmin, which gradually breaks down the fibrin of the clot. Additionally, bradykinin, a vasodilator, is released, reversing the effects of serotonin and prostaglandins from the platelets. This allows the smooth muscles in the walls of the vessel to relax and helps to restore the circulation. Plasma anticoagulants. An anticoagulant is any substance that opposes coagulation. Several circulating plasma anticoagulants play a role in limiting the coagulation process to the region of injury and restoring a normal clot-free condition of blood. For instance, antithrombin inactivates factor 10 and opposes the conversion of prothrombin or factor 2 to thrombin in the common pathway. Basophils release heparin, a short-acting anticoagulant that also opposes prothrombin. A pharmaceutical form of heparin is often administered therapeutically to prevent or treat blood clots. A thrombus is an aggregation of platelets, erythrocytes, and even white blood cells, typically trapped within a mass of fibrin strands. While the formation of a clot is normal following the hemostatic mechanisms just described, thrombi can form within an intact or only slightly damaged blood vessel. In a large vessel, a thrombus will adhere to the vessel wall and decrease the flow of blood. In a small vessel, it may actually totally block the flow of blood and is termed an occlusive thrombus. There are several medications that impact the coagulation cascade. For example, aspirin is very effective at inhibiting the aggregation of platelets. Patients at risk for cardiovascular disease often take a low dose of aspirin on a daily basis as a preventative measure. It also routinely administered during a heart attack or stroke to reduce the formation of a platelet plug. Anticoagulant medications such as warfarin and heparin prevent the formation of clots by affecting the intrinsic or extrinsic pathways. Another class of drugs known as thrombolytic agents are used to dissolve an abnormal clot. If a thrombolytic agent is administered to a patient within a few hours following a thrombotic stroke or myocardial infarction, the patient's prognosis improves significantly. Tissue plasminogen activator, or TPA, is an example of a medication that is released naturally by endothelial cells, but is also used in clinical medicine to break down a clot. So common nursing pharmacology, common cardiac disorders. We have reviewed the basic anatomy and physiology concepts of the cardiovascular and renal system. So now it's time to discuss common cardiac disorders. Hyperlipidemia. Cholesterol is a fat, also called a lipid, that your body needs to work properly. However, too much bad cholesterol can increase the risk for heart disease, stroke, and peripheral vascular disease. The medical term for high blood cholesterol is hyperlipidemia. There are many types of cholesterol. Total cholesterol is all the cholesterols combined. High density lipoprotein or HDL cholesterol, often called good cholesterol, because it promotes the excretion of cholesterol. Exercise helps to increase HDL and remove cholesterol from the bloodstream. Low density lipoprotein or LDL cholesterol, often called bad cholesterol because it stores cholesterol in the bloodstream, which contributes to atherosclerosis. A comparison of LDL, bad cholesterol, and HDL, good cholesterol. For many people, abnormal cholesterol levels are partly due to lifestyle choices, including a diet that is high in fat, being overweight, or lack of exercise. However, disorders can also be passed down through families that lead to abnormal cholesterol and triglyceride levels. In addition to lifestyle modifications, such as a low-fat diet and exercise, hyperlipidemia is treated with anti-lipidemic medication such as atorvastatin, also known as Lipitor, to help prevent long-term complications. Hypertension. Chronically elevated blood pressure is known clinically as hypertension. High blood pressure is treated with lifestyle changes and medication. New American Heart Association guidelines states that hypertension should be treated at 130 over 80 milliliters of mercury rather than the previous standard of 140 over 90. For an image of healthcare professional obtaining an accurate blood pressure reading that will be used to determine a treatment plan for the patient. It is critical to obtain an accurate blood pressure that will be used for the development of a treatment plan for hypertension. About 68 million Americans currently suffer from hypertension. Unfortunately, hypertension is often a silent disorder, meaning no symptoms occur until complications happen. So, patients may fail to recognize the seriousness of their condition and fail to follow their treatment plan. The result is often a heart attack or stroke. Hypertension may also lead to an aneurysm or ballooning of a blood vessel caused by a weakening of the wall. Peripheral arterial disease, such as obstruction of the vessels in peripheral regions of the body. Myocardial infarction, chronic kidney disease, or heart failure. Many cardiovascular medications are commonly used to treat hypertension, such as diuretics, ACE inhibitors, beta blockers, and calcium channel blockers. Thrombi and emboli. Thrombi are most commonly caused by vessel damage to the endothelial lining, which activates the clotting mechanism. A thrombus can seriously impede blood flow to tissues or organs. Deep vein thrombosis, or DVT, can occur when blood in the veins, particularly in the legs, remains stationary for long periods, such as during and after surgery. Typical symptoms of a DVT include unilateral edema and redness. Typical signs of a DVT include unilateral edema and redness when a portion of a thrombus breaks free from the vessel wall and enters the circulation. It is referred to as an embolus. An embolus that is carried through the bloodstream can be large enough to block a vessel critical to a major organ. When it becomes trapped, an embolus is called an embolism. In the heart, brain, or lungs, an embolism may cause a heart attack, a cerebrovascular accident, CVA, or otherwise known as stroke, or a pulmonary embolism. These are medical emergencies. Medications such as aspirin and warfarin are used to prevent the formation of clots in people who are at risk. Heparin is a medication that can be used to prevent or treat clots, and TPA is used to dissolve severe clots causing ischemia in the brain, heart, or lungs.